Good evening, community, and welcome to the 4th ALA Executive Seminar with Dr. Zukiswa Zingela. My name is Mandela from South Africa, and I am the Head of Wellness at African Leadership Academy. This evening, as mentioned, we are joined by Dr. Zingela. She is the Head of Department of Psychiatry at Walter Sisulu University in South Africa. She has been a medical doctor for 21 years and a specialist in psychiatry for the past 14 years. She's involved in the supervision of multidisciplinary teams focusing on psychoeducation of high school pupils on drug abuse, depression, and suicide. She's a member of the anti-stigma team within the South African Society of Psychiatrists and is a steering committee member advising youth treatment centers for substance misuse. Most recently, she's leading the Sisonke initiative, which is a mental health support program delivered in the form of psychological preparedness training for frontline healthcare workers in the Eastern Cape. Welcome, Dr. Zingela, and thank you for making time to participate in this conversation. Dr. Zingela, I think you're still on mute.
My apologies. Thank you so much for that illustrious welcome. And I would like to say good evening to the rest of the community out there. And just a slight correction, I've actually been a psychiatrist since 2003, which is about 17 years. But thanks for that illustrious introduction.
All right. For our listeners to get to know you a little bit better, can you share a bit about your background, where you're from, and how and when did you get into the field of medicine and mental health care?
Okay, thank you for that. I am born and bred in Port Elizabeth, which is in the southeast of South Africa for those who are not South African, and grew up in a township called Zwide, which is now famous because it is where our current rugby captain, our national rugby team, the one that won the World Cup, it's where he's from, Psychologist. So that's where I grew up, went to school there, and high school I went to a nearby township called New Brighton, Tembelihle High School. And from there, I then went on to do 1 year at Fort Hare University, where I wasn't really sure what I wanted to do. But after that, I actually went to the University of Natal, where I did my medical degree and qualified in 1995, went back to Port Elizabeth because I felt, I wanted to be home, because that's part of the reason I did my medical degree is I actually wanted to serve my community. And while working in Port Elizabeth, rotated through a number of disciplines. And then, I had this thought that, when I was in medical school, I really enjoyed psychiatry. For some reason, that discipline or this discipline spoke to me. So I then decided, it would be a good idea to consider specializing. So just to see if I was okay with psychiatry or not, I went to a local hospital in Port Elizabeth. It's called the Elizabeth Dongan Hospital. I worked there for about 2 years. And in that 2 years, I then decided, yes, this is definitely the discipline I want to specialize in. And I then went to University of Pretoria, where I specialized for 4 years, qualifying in 2003. So for me, the journey into medicine, I suppose since I was a little girl, and part of it could have been because my mother was first a nurse, and then she went back to school and started to become a doctor. So I sort of had an idea that I wanted to be in the medical field. And at some point that thought formed into not only in the medical field, but I actually want to be a doctor. And it was only in my progress in my studies that I then focused more on psychiatry. And the reason is because I found it a fascinating concept that you could have the different ranges of mental disorders, but you could also have in the same mind, in the same human brain, a brain that works relatively okay at other times, but then is disturbed at others. So I really was interested in finding out what goes wrong where that would actually make somebody become mentally distressed or ill. And, you know, what can be done to actually preempt or stop that from happening, if anything. And I must say, since deciding to do psychiatry, I found it a very, very fulfilling career. And I can say for sure that it was the right choice for me. It is just the right fit. So yeah, that's me, you know, taking you from where I grew up to where I am now. And there came a point where I went to work in the United Kingdom. It was actually a very good experience because I was with my partner and my son at the time, and we got exposure to a different kind of mental health service, which is different to what we have here back home. And that in itself, you know, worked very well in terms of completing the kind of experience I wanted to have. And by the time we then came back 5.5 years later, I already had a clear idea that ultimately I want to work in the public sector, and I'm also very interested in academic psychiatry. And we came back to South Africa in 2008. And from then on, although I did a short stint in private practice for about 3 years, I've basically been in the public sector. And, you know, even though there have been frustrations, as are frustrations everywhere one ends up, it's really been more good than bad in terms of my work experience and in terms of the different initiatives that I've actually been able to be part of. So that's me in a nutshell.
Thank you so much for that comprehensive background of how you found yourself in medicine and in mental health. It's good to know that you always had in mind going back to your community and serving there. And I think we'll learn more about that shortly. Before we continue, I'd like to let our listeners know that we will start with an interview between myself and Dr. Zingela. I'll ask a series of questions to help us understand the work she's doing. And then after 25 minutes, we will have a Q&A. You may pose questions immediately using the Q&A function on your screen, and we will attend to those questions during the Q&A section. You may also vote for questions by giving a thumbs up so that we can see which questions are important to our listeners and make sure that Dr. Zingela gets a chance to answer those. All right, so Dr. Zingela, can you let us, right now you are heading the Department of Psychiatry at Sisulu. What does your current work entail?
Okay, so it's mainly focused on academic work, but obviously I head a team. And the team is not only focused on psychiatry, but also on human behavioral sciences. So there are psychologists in the team, social workers in the team, and doctors that we're training, postgraduate doctors that we're training in psychiatry. We also teach medical students who are doing their MSHB degree or medical degree through Sisulu University. So the main campus is based in Mthatha, where we are at the moment, but we've got many other campuses throughout the Eastern Cape. Currently, we're the only medical school in the Eastern Cape, although there are plans to open a second one soon. And where we are is Mthatha main campus. We've got a campus in Port Elizabeth, where we undertake mostly teaching of undergraduate and postgraduate students. We've got a campus in Queenstown. We've got a campus in Grahamstown and East London. And if you then look at those campuses, that's where we have a lot of presence in terms of our input academically. So what we basically do is we divide our time between the teaching, both of undergraduate and postgraduate students, but also clinical service for the Nelson Mandela Central Hospital, which is basically where we're based at the moment. And I'm saying we because we run this as a team. So although I'm head of department, each member of the team has got a very important role to play. And through working together, we've actually managed to really make a difference. Even though it started off as a relatively small department, we have managed to do quite a lot considering, the size of the job we have to do clinically, academically, and considering the challenges, because we are mainly a rural university. So, the other challenges that we are previously, or actually I shouldn't even say previously, one of those historically disadvantaged universities where money was not really invested compared to other universities in South Africa. So there's a lot of challenges that we still have to overcome, but despite that, you find that the work we are doing is on par with a lot of other departments of psychiatry across the country, which have not been as previously disadvantaged.
Thank you so much for that. Sounds like you have your hands full. And also sounds like you're doing a great job leading your team and empowering them to also feel part of the team, but also part of the solutions you're providing to the university and the community. Just a quick note to our viewers, we're also broadcasting on Facebook. And so they also may be able to pose questions to Dr. Zingela through the comment function, and those will be attended to as well, given time. Dr. Zingela, you are doing great work, but difficult work. So I want to ask you about what's currently happening in the world and in South Africa. I know that you're leading an initiative, and I'd like to understand what that work looks like. The global pandemic, which is COVID-19, has brought our lives to a grinding halt. We see health workers, mental health workers being called to the front lines to support affected and infected persons. Can you tell us about the initiative you're leading that's related to supporting frontline healthcare workers?
Okay, thank you very much for that question. And what I'm going to do is pretty soon I'm going to be sharing some slides which give one a better idea of what we're doing. But just as a preamble to say, part of the reason that this project was started, is a few weeks into us having reported the first case in South Africa, I was hit by the realization that with this outbreak and how we have seen it affecting different countries across the world, we are bound to have an increased mental health burden in the general community, first of all, because of a number of reasons, but also in our frontline healthcare workers. And the question I ask myself is this a kind of scenario where we sit and wait until our frontline healthcare workers come and say, I need you to intervene in some way? Or is there something we should actually be doing to preempt that so that they feel more supported? And the other thing that occurred to me was to say, if you look at the number of psychiatrists in the public health sector in the province that I'm working in, that's the Eastern Cape, currently we stand at 13. If you look at the population of the province, we're close to 7 million. So that gives you a very good idea that with 13 psychiatrists for close to 7 million people, even when we are then confronted with the crisis that can happen with our frontline healthcare workers during the outbreak and the aftermath after the outbreak, we will still find that we do not have enough capacity to address our frontline healthcare workers individually. So then came the idea to say, if we can't do it individually, and if we cannot afford to wait, what should we be doing now? Which is when I then came up with the idea of the Sisonke team project. And what I'm going to do now, with permission from you and our participants out there, is I'm going to ask that we share a screen. And when we are sharing that screen, you'll then be able to see exactly what I'm talking about, because I'm going to take you through a few slides, not all of them.
Okay.
So I'm going to hear from you if you're actually going to be able to see. Let me just see if I've opened it successfully. Here we are. Bear with me. Oh, that's what's happening. My apologies. There seems to be some box that has opened related to. Okay, so basically while I'm waiting for that to load properly, I am going to continue describing the team. So where we started with the team is we started operating it in Umtata. Remember, I had mentioned before that we basically have two teams, and I had mentioned before that one team is in Umtata and the other one is in Port Elizabeth. So yes, what we basically did is we started with a team in Umtata, and the first launch date was on the 2nd of April when we offered the training for the first time to our frontline healthcare workers. Today we are on the 30th of April, and I can say that between Umtata and Port Elizabeth, we've managed to train over 300 of our frontline healthcare workers. And how we have been doing it is we have basically been able to issue invites to our frontline healthcare workers, and the invites are very clear. They indicate that this is not targeted at treating a specific disorder because none is diagnosed. It's targeted at offering training so that you can feel that you are able to cope with the anticipation of the crisis, especially when numbers of patients start to surge, and it is done in preparation for you to be sure you know what to do should the situation feel overwhelming. And we take 8 members of frontline healthcare teams at a time, and we are able to then accommodate them in a space that allows for social distancing. It also allows for us to stick or be within the regulations of lockdowns. We obviously have an eye towards safety, so people come in having to wear surgical masks, use sanitizers as much as possible to make sure that we do not become a source of spreading the infection. Mm-hmm. And just to digress a little bit so that our participants can then understand what we're talking about. If you look at the mental health aspects of COVID or the COVID outbreak, you will find that feelings of anxiety, fear, and panic are quite normal because this is a situation which is highly abnormal and very stress-inducing. And I think one of the things that people forget is as much as we are frontline healthcare workers, it is actually the first time many of us have been faced with such an acute epidemic or pandemic. I mean, we've had TB, we've had HIV, but that's more chronic. And therefore, the major changes that occur in your health system are not as evident. And if you look at our history in South Africa, although we've got our own dark history to do with HIV and high mortality, it's been years since we've actually had our communities on, antiretroviral treatment. We've managed to stabilize quite a lot of them. So in saying that, I'm saying a lot of our current healthcare workers are not used to being confronted with, an enormity like a pandemic that is so acute, happens to kill some people that it infects, and has such a devastating effect on country's economy, the country's healthcare system, and so on and so on. So as a result, therefore, it is important to remember that even though healthcare workers present themselves to work every day, it is a big challenge overcoming those overwhelming natural feelings that we're talking about. And we also recognize that in line with what has been described in China, there is, a high risk of some mental health distress, or rather some mental health disorders. And we've seen in one study in the province where the outbreak began in China, that up to 50% of frontline healthcare workers, they ended up with depression, anxiety disorders, some with substance-related problems. So what is then important is mental health teams have got to understand that as small and limited as the resources are, it is important to actually look at the capacity of what a mental health team can achieve, and to then try and see if the capacity is limited, what else one can do to try and increase that capacity. So one of the things that I feel is important to remember is that as mental health teams, looking at a mental health burden that might or is expected to accompany this outbreak, we need to accept, first of all, that we will not be able to do this work alone. So it's going to be important to actually try and optimize the current available systems within our communities. So it may be formalized systems, it may be informal systems, but utilizing what we have in the community is actually going to be very important. And an example are civic organization, NGOs or NPOs, religious organizations. These are organizations or networks within the community that actually have a track record in working hand in hand with communities to solve local problems. So that's actually the first thing we need to realize, is this will not be something that we will solve on our own. The second thing, it's going to be important to make sure that in the communities we work in, we are able to provide some information about how the local people can access help when they are affected negatively by the outbreak and it affects their mental health. But we also need to be able to provide information to our frontline workers so that they also know how they can access the help they need. And then I think then for mental health teams, especially if capacity is limited, it might be a good idea to then look at what the capacity is, what the criteria for intervening will be for the teams, and communicating that to the healthcare workers, to the different teams within where you work, so that everybody is clear at which point they should then be referring to mental health teams. So that's literally just, a sort of idea of how one should proceed from here to try and make sure that you have considered or taken the community into consideration and their mental health needs, but you've also considered the frontline health workers. And if I then look at what we ended up coming up with, the Sisonke team project, I had to then look at what had been done in preparing communities who were facing natural disasters. Because for me, that actually was a kind of scenario that I was able to then adapt to the COVID outbreak. And what is important to remember there is that in these instances when communities have been faced with natural disasters, there has been work that was done to get them psychologically prepared, and there has been some work published on how that was done and what worked and what didn't work. And we then came up with the idea of psychological preparedness training for COVID outbreak specifically. And if you then look at how we would define what psychological preparedness is, we were referring to a state of awareness and expectation of what your reactions are going to be to the COVID outbreak or crisis, having the ability to identify specific stress-related emotions and thoughts which are generated by the COVID outbreak, and also being able to deal with whatever negative emotions and thoughts that you have then identified. Nice and simple in theory, but what we then had to do was to say, how do we then take that and translate it into a program that we can then use to train frontline healthcare workers? So first of all, we had to sit as a team. I had to present the idea of what I was thinking, and we had to then share ideas of how we felt this would work and how we could implement it where we are. And where we are, just so everybody knows, we are basically, we are based in a tertiary general hospital with a mental health unit. And the mental health unit has 60 beds. So the majority of the services that are undertaken in the hospital where we are general medical and surgical services. And in addition to that, we also have a hospital, which is functioning at a regional hospital service level, which is quite close to us, and we literally get a lot of referrals from them as well. So if you then look at the response of the hospital where we are based to the COVID outbreak, you will find that the accident and emergency teams are literally going to be confronted with having to screen, having to test, and having to admit. And the teams in different departments like internal medicine, family medicine, you know, and even the surgical disciplines, all of those departments are actually going to be faced with having to provide care. Then you've got the ICU teams and the anesthetists and high care teams. They will also be required to provide care. So when we designed this program, it was initially with them in mind. But what we then realized is since launching the program, everybody who is working within the hospital sector actually says very clearly that they benefit from this program, they find it very useful, and it should then not be limited to just these groups that I've counted. So what we do is we focus on 5 principles that are based on a paper by Hopful and others. It was issued or published way back in 2007, and it was a consensus paper that lifted 5 essential elements that had to be covered in order to make sure that you are intervening appropriately in mass trauma situations. And I frankly view this COVID outbreak as mass trauma. The whole world is traumatized. So because of that, we then had to take that attitude. And those principles we then share with attendees when they come for the training. And we try to help them promote a sense of safety. We definitely do quite a few things to promote self-calming techniques. We focus on what they can do in terms of improving self-efficacy, in terms of improving team connectedness, and lastly, in terms of promoting hope. And for for us, that is actually crucial. What we find is that the resources required are quite limited and inexpensive. As I mentioned, you need a room that's big enough. You need, you know, a couple of facilitators, and then you just need pen and paper and a whiteboard and whiteboard markers. And there you go. What we are finding is that when we do the training, we do it over a period of about 45 minutes of the actual techniques, another 10 minutes of relaxation techniques, and then we cover, you know, how to best take care of each other and the team in another 10 minutes. And then at the end of it, we give the attendees a chance to then give us feedback about the training. And what we are finding, as simple as it sounds, is that at every training session, there isn't a single person who walked out of there saying it was a waste of their time. Every single person who has attended has given such overwhelmingly positive feedback about it that we are surprised at the extent to which it has been welcomed, but also at the extent to which people have said it's made a difference to how they view the outbreak, how they feel they're going to cope, and so on and so on. So for us, the usefulness of this, I'm sorry, I'm just skipping through the slides. The usefulness of this has been, it was initially intended as something that we can offer now before the crisis becomes overwhelming, which we were hoping would support the frontline healthcare workers in a way that feels that makes them feel confident and makes them feel they are coping. And what we did not anticipate was a lot of the feedback that has come back to us has also been something along the lines of, not only is it helping me cope with the crisis or idea of the crisis of COVID-19 outbreak, but I'm also applying it to other crises at work or in, general, in life challenges. And I'm finding that it's working for that as well. So for us, that has really been positive. And what I want to do at this point is I just want to share a picture. So as you can see, that is the team in Umtata. And if you look at the team, it's made up of psychiatrists, medical doctors, social workers, clinical psychologists, and a registered counselor. And if you look at that one, That is the team in Port Elizabeth. So if you now take into context the fact that we've got, you know, so many frontline healthcare workers who are affected out there, what has encouraged me about the Sisonke project is that even though our numbers have not been that many, the number of healthcare workers that we have been able to cover within the time since we started has been a high number. And for me, I think that has been the most significant thing, being able to actually, intervene before we have specific psychiatric disorders, and also being able to get feedback immediately that says, yes, this is definitely helping me. So I will stop there for now.
Thank you so much, Dr. Zingela, for walking us through the work that your team has done. Outstanding work. I have no doubt that the health workers that you've been working with, all 300 of them, are grateful for the skills and the resources you've equipped them with to be able to continue doing their work, but also take care of themselves and be able to respond to their own emotional and mental needs. We've aroused a number of questions from our audience, and so I want to switch to those and give you a chance to respond to them. We've got a question from Neria Atuharim, who says, how are people who already have mental health disorders being affected? I assume that the mental health workers will be overwhelmed with the elephant in the room. I know I may get some backlash on this question, but these people are still important. How are we catering to their needs?
Okay, so I think that's actually a very relevant question. One of the things that we've had to do, Miriam, is we had to then look at our usual routine work, which entails 3 clinics, 3 very busy clinics a week. And via those clinics, I would say the number of people we get to see per month can be anything up to, let's say, 1,600 per month. So what we had to do is, in that number that I've given just now, there are those who are relatively stable, who come for review, and then there are those who are acutely ill. So the first thing we had to do, and this did not apply to just the Department of Psychiatry, it applied across all departments. Because remember, I said we're in a general hospital. The first thing we had to do was to say, all those who are stable and who come in for routine review, let us find a way to get them to follow up at their nearest clinic rather than coming all the way to hospital. First of all, it will save them money. Secondly, it will save them from exposure to potential infection if there are other people who are coming in with the infection, because the numbers that come to our patients are quite high. The second thing was to say, those who are acutely ill, we will still continue to review them, or rather assess them and manage, by offering input. So in terms of our routine duties, we still continue with our routine duties. And all we did was to say, those who can follow at their nearest clinic, please follow up there. And those who actually require more expertise in terms of input, because they're still relatively unstable, continue coming to us, and we'll continue to provide us with this. So, you are correct. People with existing mental disorders also require intervention, and that is actually part of our daily routine duties. We still operate our inpatient unit. Remember, I said it has 60 beds, or operates to 60 beds. But because we've had to think of an ability to isolate those who might be infected, we've actually had to cut down a little bit on that number, just to make sure that we have an ability to isolate people while we are still waiting for tests. So we're definitely catering for people with existing mental illness as well. Thanks for your question, Mary.
Thank you for your response. Very clearly there's a thoughtful process in place to respond to those already struggling with, or who have pre-existing mental health illness. We have another question from Zukiswa Zingela, and it says, media reports of deaths far outweigh those of recoveries and preventive measures. Does it not contribute to panic and depression? What advice can you give to address this issue?
Okay, that's actually a very important question, and it's one that often comes up in the training. And I think what is important for us to remember is that if we focus on the deaths and the recovery only, the message we're actually going to be getting from that is exactly what Sisulu is saying. But what is always important, and we tend to do this in our sessions as well, is we look at the whole picture. Because if you look at the whole picture and you look at the number of people who are infected, or rather, let's say, who have tested positive, because we do not know the number of people who are infected. We only know those that have been tested. So if you take the number that have been tested, and then you compare the deaths to the number that has been tested, that actually gives you a much, much better idea. And although I did not settle on the screen when I was going through the slides, there is a particular slide that I captured from the Worldometer, which basically gives you live updates on the stats on COVID-19 infections, deaths, and so on and so on. So if you look at those stats, and my advice would be, if Sisulu can do that, it would be good to go and look at them. If you look at those stats, there is a very clear number that stands out there. And it gives you the number of people who are infected and who are mild in their presentation, and the percentage of those who actually have severe disease. And the percentage of those who have severe disease is only 3%. So I'm saying, even though the numbers, might be scary, you have to take them, as a whole. Because when you take them as a whole, then you actually are able to put the numbers into better perspective. So that's the first thing. The second thing is to say, yes, he's correct. I think I mentioned this before. It is quite normal to react with anxiety, with panic, with depression, because this is the kind of scenario that is abnormal, as I mentioned, and it generates exactly these kinds of feelings. And what we are then saying is that from where you are, despite all of these things that are happening around you related to COVID, which seem overwhelming, it is very, very important to keep your eye on what is also happening that is positive. Because if you're able to actually balance your view, you then have a better idea of what is potentially possible, what is the worst thing that might actually happen, but also how we might be able to overcome this. What I mean by that is to say, if you wake up feeling anxious or depressed about COVID, imagine if you actually spent your whole day in that state. Now compare to when you wake up anxious about COVID, but you are at least able to focus on the things you can control within your environment. So what we then encourage people to do is to focus on the things they can control. You cannot control the number of infections out there, but you can control whether you become part of that statistic or not. And one of the things you are encouraged to do is, if you're not an essential healthcare worker or other essential worker, stay at home. If you have to go out, wear a mask. If you have to interact with anyone, anywhere, make sure you keep your distance. Make sure you wash your hands. So these are the things that we remind people to do, because remember, when we're talking about the principles that one have, or the goals that one focuses on when you're trying to at least, empower people to self-help, you need to focus on how to stay safe. And if you stay safe, you actually make your family safer, because it means you're less likely to infect them, which means you are making your own environment safer. And those are the things, the practical things that we actually advise people to do. Focus on what you can control in your environment. Do what you can. Please learn about this. You don't have to go and learn fancy things, just the basics, how it affects people, how you can make sure you stay safe, what are the things you can do to help yourself. The other, tips we also share with people is, what the, usual healthy stuff is you got to do. Make sure you eat reasonably healthily. Make sure you get some exercise. Make sure that you stay connected to people, even if you do it through social media, through other means, while still keeping that physical distance. Make sure that in your day, you've got an idea of reasonably, well-structured or planned activities of what you're going to do for that day. But also don't be hard on yourself. If you're not able to do the 5 activities on your list, it's fine if you've done 2 or 3. You still have tomorrow. So I'm trying to say, if you are able to at least focus on the things you can do to improve your life, but also the things you can do to stay safe, those are the things that will actually help you control your anxiety levels better. And of course, then, you know, there are practical examples of using relaxation techniques to calm yourself down, and also trying to focus on other things within your environment, within your community, or, you know, over the news that give you hope. Please do not overload yourself with too much COVID-19 related news. Because if you do that, remember, the media tends to focus a lot on the negative, focus a lot on, you know, the deaths and people that don't necessarily get well. But please remember, there's a huge number of people who are also recovering. There's a huge number of people who actually have made it and are able to say to you, you know, I had COVID-19, I'm fine now. So those are all the tips and tricks that we try and share.
Thank you so much for that, Doctor. What I appreciate about that response is that you've also responded to a number of other questions on the call, giving people tips on how they can take care of themselves, how to engage with information on the internet. And I really appreciate the point around keeping a balanced view. While there are high numbers of infections or even deaths, the number of people who are actually in a good position to recover is higher than those who are in severe cases. So I really appreciate that point. We have another question that I'd like just a brief response from you on your thoughts here. How will the Sisonke initiative be upscaled to other facilities? Have you guys given that some thought?
Yes, we have. And what I like about that question is, this is the exact same question that we were confronted with, because we've got lockdown regulations that don't necessarily allow big groups to gather. So what we have done is, remember, I mentioned that it started in Mthatha. We were then able to train facilitators in Port Elizabeth, and they were able to continue with the training there. So what we are thinking is, for the Eastern Cape, because we are still within reach, I mean, it's quite a few hours driving here or there, but it is still possible to train other facilitators. But in addition, we are looking at different functions, like the possibility of using Zoom webinar, for example, to try and facilitate training long distance. But what that requires is an adaptation of the current program that we're doing, because the current program is actually very interactive. It relies on interactive learning and practicing during the session. And what is nice is that because of a face-to-face contact, one is actually able to build a rapport very quickly with the attending trainees. So unfortunately, one may lose a little bit of that when you do it long distance. But I've got a, you know, I think that the essential, I would say, program itself, one would still be able to keep the essential components intact enough to be able to start training facilitators via, you know, long distance. And the other thing that we're looking at is, obviously, when we started it, you know, 28 days ago, we didn't know how it was going to go. It was just this idea that said, let's try and reach as many frontline healthcare workers as possible now. What we have since realized with the massive or massively positive feedback that we received is, clearly there's a need. And people are saying that they want this. So we are looking at starting a website, and that will then be, you know, a means of sharing some of the information. And even if a person doesn't necessarily attend one of our training sessions, if one is at least able to make a lot of this information available online, then it goes a long way in addressing some of the issues, even if it is not the actual training. So we're looking at seeing how we can reach more people out there. We're still counting, I think as of the end of today, we had trained 320 frontline healthcare workers. And our aim is to get to a point where we've trained enough of our healthcare workers such that when the numbers surge, because at the moment where we are seeing a fair amount, but it's still not too overwhelming. But we expect that there may be a surge. So when that happens, we will then start off with similar interventions, but targeted at assisting frontline healthcare workers in crisis. But again, we're finding if we do it in group fashion, it actually gives us more reach and increases our capacity.
Absolutely agree with the last point. And we look forward to seeing the website when it goes live, as well as seeing different versions of your training. We have another question that speaks to a bit more around people who are not mental health care workers, but who are struggling with mental health and emotional challenges during this time. Young people, right? We have a question here about what resources, what advice, in which direction would you point young people who are, for the first time, living in a time of a pandemic, but also for the first time dealing with mental health challenges, emotional distress because of what's happening in the world?
What I like about that question is actually, a very realistic question, because there are a number of young people who actually have to deal with a lot of that. And part of it is not only has your life changed drastically, but in a lot of instances, your life has actually had to come to a stop, literally. Because you can't go to school as usual, you can't mix with your friends as usual. And if you had plans, especially if you're in a sort of crucial year where it's the year before you have to go to university and stuff like that, it literally puts a spanner in the works. And I think that one of the things that young people, I would advise them to try and remember is, this outbreak comes with a high degree of uncertainty. And uncertainty tends to lead to feelings of anxiety because you're not sure what tomorrow is going to bring. I think one of the things that I would advise is it is important for young people to remember, as much as this is a huge challenge, everybody's actually going through it. So even if your classmate or your counterpart or peer next door is not saying this, as much as you feel anxious or depressed, it is the same feeling that your peer is probably experiencing. So one of the things that young people have to remember is that you are not alone in this. This is a challenge that's facing everybody else, and therefore your reactions are not abnormal. And your reactions do not mean there's something wrong with you. And remember, that's one of the things that I highlighted in the beginning, to remember your reactions for this kind of an event are actually normal, and they are normal reactions to an abnormal situation. So that's the first thing young people have to remember. This doesn't mean there's something inherently wrong with you. This is a natural reaction to an abnormal challenge. The second thing is, when you start to feel like this, please try and find in your own environment, is there someone that you feel can at least understand where you're coming from? Is there someone you can talk to? If there isn't someone you can talk to in your immediate environment, have you got access to a phone? And on that phone, do you belong to a WhatsApp group or some other social network? Because that in itself goes back or takes us back to that connectedness that I was talking about. That says, please, when you are coping with this, please remember to stay connected. So remember this as a young person, not everybody is comfortable sharing their feelings or that they're struggling, but just making contact with a particular person or persons that you feel welcomed and accepted by can also make a difference to how you are actually coping. And if you find that you feel completely overwhelmed by particular feelings, do yourself a favor. If you have this, access to, let's say, a few basic resources, sit down, make a list for yourself of the things that you know, when I do A, B, C, it makes me feel better. And it could be anything. Some people will say dancing, some people will say listening to music, others will say, you know, running around the yard. If you don't have a yard, running around, you know, the house, trying to keep physically active. Others will say cooking, others will say baking, others will say watching a clip on YouTube. It doesn't matter what it is, but make a list of about 5 to 10 things that you know, if I do this, it makes me feel temporarily better. Now, how we're going to use that list is the times when you feel really bad. It is then a very useful sort of guide for you to say, oh, by the way, there are things that I've tried in the past which have made me feel better. How about I try number 1 on the list? And even if it just takes you a few minutes, for that few minutes, your mind is not focused so much on COVID-19 and the anxiety and depression that it brings. And once you've gone through that one, go to the second one, go to the third one, go to the fourth one, go to the fifth one. And you will find that more often than not, even if it is not a cure for how bad you're feeling, it has at least provided a sense of relief for that time, because you're not so focused on your experiences and how bad COVID is making you feel. And then in addition to things that I've mentioned before, you know, making sure you sleep enough, making sure that you eat well, making sure you get exercise, staying connected. Please, if you have any educational material or interesting material, learning new things, try and do that for yourself as well. Because as much as you're waiting to get back to normal classes, it would actually be something stimulating to get your mind focused on something other than the crisis that we're facing. And if you're able to actually balance all of that and stay connected with loved ones, because each one of us has got some loved one, whether it's mom or dad or sibling or cousins or just a close person that you're with, stay connected with them, because it is reassuring to actually hear someone else who's also maybe going through this, but who also is hopeful in terms of you know, keeping in mind that as bad as this is, we're actually going to make it, most of us, and we're actually going to be okay, most of us.
Thank you so much for those practical suggestions on how young people can take care of themselves. What I also appreciate about your response is that the suggestions you're giving are all cost effective and free, right? A piece of paper, a pen, sitting outside and thinking about how in the past you've managed through a difficult situation that doesn't cost money at all. Dr. Zingela, we are almost out of time, so I'm going to prioritize 2 questions. One of them is going to help our listeners to be able to access and engage you beyond this call. So if one would like to support the Sisonke initiative, engage with you about any initiative that they have back home, or have any further questions, how can they reach you?
I'm going to ask that we share my email address, and I'm going to read it out. So it's my surname Zingela, all small case, followed by my initial Z, at mweb, so that's mweb.co.za. I'm going to repeat it. It's my surname Zingela, initial Z, at mweb.co.za.
Okay, thank you for that. And for those listening, we will try and share that with you as well if you'd RSVP'd for the call, so that you have access to that. The second question that I want to give you a chance to answer is, so in South Africa, for example, there's this conversation going on about schools reopening soon. And so for many parents, that's anxiety provoking. But also for schools, right? Schools are also thinking about how to welcome back students and while keeping them safe, while observing social distancing, etc. So what do you hope schools will do to prepare for the return of students, but also to prepare students to be able to manage their own wellness during this time?
What I like is that I think it was yesterday that you had a number of different officials from the Department of Education who were trying to outline a plan. And in that plan, I like the fact that they actually had a slide dedicated to psychosocial support for schools. Now, if you look at the readiness, I think it depends where you are, because some schools may be more ready than others. And I think what a lot of parents have been fearing is, as much as we're looking at schools reopening, will we actually be able to get the schools COVID-19 proof, in inverted commas, meaning in terms of making sure that the schools are disinfected, there are enough ablution facilities, you've got enough water, but in addition, what about the regulations that say that where we're going into, which is, I think, level 4, which for those who are not in South Africa, basically determines what activities are allowed. So going into that, scenario of level 4, everybody is supposed to be wearing a mask. So how are schools actually going to be able to make sure that that happens, especially the young kids? The older kids, you can at least say, please keep your mask on and you hope for the best. But the young kids, as much as we all put on masks, I mean, I put on masks every day when I go to work, it is not always a comfortable thing. And the first natural thing a child will do is to want to take it off. So, if you look at the readiness of schools, I would say it is very, very important to at least make sure that as much as we are trying to get our kids back to school, we are doing it in a safe way that does not then, add an ability or potential to escalate the number of infections. And in order to actually make the schools COVID-19 proof, so to speak, it becomes a multi-sectorial initiative. It's not just dependent on the Department of Education. Because if you think about it, if there are infrastructure problems at the school, this is not something that the Department of Education can, solve alone. If there are, social challenges in terms of the pupils being able to get access to transport, to actually make sure they get to school safely, that's not something that Department of Education alone will be able to get right. So I'm saying, in as much as our Department of Education has actually released a sort of blueprint of how they see a return to school occurring, it is going to be equally important for each school and each region to actually look at the schools that they have in their region and to say, what is our ability or capability of being able to reopen schools in a safe way according to these guidelines that have been issued by Department of Education? And that, I think, is going to be a discussion that the school will have to have with its staff, but also with its school governing bodies and the parents, just to make sure that everybody is on the same page about what needs to happen before children can actually get back to school safely. And then when it comes to the psychosocial intervention, I think Department of Social Development has already been sort of highlighted in that plan of Department of Education to say they expect some intervention from there. I saw they also highlighted Department of Health. And in that instance, one would actually need to balance what we have in terms of routine services that we're providing and any additional needs that school children will actually end up having. But as if you look back at the other question that we received now, how are young people supposed to cope? Those are the basic considerations that everybody who works with school children will have to keep in mind. So it's going to be a tricky one. It may be doable, but it will require everybody to actually, put their heads together and come up with a plan that is specific for each school and each region.
It's definitely an all hands on deck situation. And what I appreciate as well is the same skills and tools you're giving to healthcare workers or parents or individuals. Teachers can use this in their classrooms to help their students calm down, be aware of their emotions, and then think about how to cope as they return back to school. Dr. Zingela, it's been such a pleasure. And I've not been able to get through all the questions because of time, but we have learned so much from you. We appreciate the work you and your team are doing in the Eastern Cape. We look forward to seeing it go across the nation and maybe even the continent soon. I am going to now hand over to my colleague, Kgalalelo, who's going to close for us.
Thank you so much.
Hi everyone, I am Kgalalelo from South Africa, the coordinator for the ALA Executive Seminar Series, and I hope you're all well today. Wow, today's topic and the insights that were shared by you, Dr. Zingela, are universally relevant, not only for the community that has joined us today on this webinar, but also for those who will be able to view this webinar and this recording well beyond today. So I think it's safe to say, rest assured that your work's impact will be far-reaching, and thank you very much for joining us and taking the time to speak to us tonight. Mandisa, I know you've been knee-deep in making sure that the ALA community, and especially our students, are well taken care of and that they're well holistically, including mental health. So thank you very much for taking the time to facilitate tonight's webinar. And finally, thank you to all the attendees that have joined us here on Zoom, but even as we've been streaming through Facebook, we've had audiences from Togo, from Kenya, Uganda, even from the USA. So thank you for joining us and taking this time to join us tonight. Some of you have even joined us from the first series that we had 3 weeks ago. So we continue next week with Ms. Nicola Gambelik, who is the Director of Operations for the COVID-19 Solidarity Fund, and we'll be looking at the social work that they've been doing there and how you can get involved yourself. So we look forward to interacting with you next week. As always, please reach out to us if you do have recommendations for incredible speakers, industry experts who'd be willing to speak to us on such a platform as this one today. Otherwise, from myself and the team, thank you very much for joining us. Stay safe and goodbye.
Thank you. Good night.